This is Dr. Babak Azizzadeh. You are listening to the Smile Podcast, where I will be sharing with you my unique and holistic perspective on beauty, health, and wellness. Hello. Millions of people have surgery every year.
Or you could just get a boob job.
Using targeted Botox can be a miracle.
Smiling like that is a skill.
Your surgery has been successful. Hi, everyone. Welcome to the Smile Podcast, where we try to give you the latest and greatest information about beauty, health, and wellness. I'm Dr. Babak Azizzadeh. I'm coming to you from my house. And today's special guest is a phenomenal physician, surgeon, plastic surgeon, Dr. Jon Cabin. We're very, very fortunate to have him join us from his house. As we've started our Zoom and are doing more and more of these Zoom podcasts until we can go back to the studios. So thank you, Jon, for agreeing to take your time to talk with us about everything we want to know about coronavirus and its impact on plastic surgery and the future of plastic surgery. So welcome, and thank you so much for being with us.
Thanks for having me. It's always fun setting up a Zoom studio in your bedroom. So here I am.
No, it's nice. I like the beautiful trees, and this is really
trying to stay zen.
I had to go with the background because otherwise it'll be like walls and doors and things like that. So so it's great being able to communicate with you whatever means we have. So Dr. Cabin and I'm very, very fortunate because Dr. Cabin and I are colleagues. We practice together, and we have been fortunate enough to really, really think about the future and make sure that we're sticking to safety standards and so forth during this pandemic in the industry of plastic surgery. And so Jon, my first question to you is, what do you think the impact has been on aesthetic and reconstructive plastic surgery? And tell us a little bit more about kind of the current state of affairs with this coronavirus pandemic.
Yeah, thank you again for having me. It's always a pleasure to chat. It feels like the way to socially connect right now is through video, so this is nice. I think this has been pretty. I mean, from a professional standpoint, from a financial standpoint, this has been a pretty devastating period, I think, for anyone practicing any kind of elective medicine. And it's no one's fault but the pandemic's. It's just the nature of what's going on. I think plastic surgeons are not immune to that. A lot of the restrictions around elective procedures apply to plastic surgery. All of them do, because what we're doing, especially when we're doing cosmetic surgery, and a lot of times with reconstructive as well, is not emergent or urgent, and we're putting off anything that's not emergent or urgent. And you have a lot of people who are also in private practice, and private practices are businesses, and they are not able to do the things that make them money now. So overall, it's been pretty devastating, but for a very good reason. So it's not, no one's angry about it. It's just been hard.
Yeah. And one of the things that, I recently sent a viewpoint to our journal was that so the restrictions just for the consumers, like at least in California, we're in Beverly Hills, and the city has restrictions for, a non-urgent elective surgery. And the state also has restrictions, although Governor Newsom just recently started easing those. But basically the key thing that we need to, as a consumer, you need to be aware of, elective surgery falls into two separate categories. One is medically necessary procedures can be elective. The other thing is cosmetic procedures that are just enhancements can be elective. And medically necessary procedures can fall into two categories of its own, right? You have urgent cases that you need to do, and there are non-urgent medically necessary cases. So the urgent medically necessary procedures still need to be done. And Jon, you have some experience with that. There are patients that you need to take care of, and maybe we can kind of talk about that a little bit.
Yeah, for sure. It's a really good way to summarize it, categorizing it like that, and it's exactly right. Um, I'm fortunate to have a part of my practice that deals with reconstruction, and I've been seeing a lot of patients who, when we're all home, kids and adults, we're out of our routines, and people are getting hurt. Believe it or not, you think of people going out into the world and falling off a bike, but actually in your home, people are doing stuff in their home they're not used to doing, cooking, doing things indoors for kids. People are falling and hurting themselves. And so I've seen a lot of that, in my practice now. But of course, anything cosmetic or elective, non-urgent is not being done now. And I think regardless of what the state or the government says, it's from a ethical standpoint and from a medical standpoint, it in terms of society wellness, it just doesn't make sense to do those things now.
Yeah, at this point. And for basically some of the things that I think we need to be aware of, there are lacerations that are happening. We're actually, I think one of the things we want to move those away from the emergency rooms, which need to be kind of preserved for COVID patients and so forth, and moving them into outpatient facilities or clinics or offices. There's also cancer, head and neck cancer or skin cancer that has urgency. There's melanomas that need to be removed that, if you wait a month, it could impact that person's life, or head and neck cancer that may be impacting someone's throat and that needs to be reconstructed. So these are cases that still need to be done within the plastic and reconstructive surgery world. But there's certainly, we have to be very, very self-conscious about, what should and should not be done. And I don't think this is going to last much longer, because I think one of the initial thoughts as we were talking before we started was we need to conserve, even if we're not doing these procedures at the hospitals, we need to conserve protective personal equipment. And that's what was going to be missing. So when do you think these things are going to be eased, Jon, in this process?
I think it's going to be stages. And I think there's going to be some learning lessons as we open up in terms of what can be done and what can't be done. I think probably within the next 4 to 6 weeks, we'll see. I know in certain states people are eased up already, but in the state of California, we'll see opening up of non-surgical and some surgical elective cases. But then there's going to be careful monitoring. There's going to be a very, very strict limit on how many patients can be in the office at the time. We're going to be wearing protective equipment we don't normally wear. But I do think one of the special categories for you and I in this whole thing is that we're facial plastic surgeons. We really focus mostly on the head and neck. And one of the interesting things about this virus is that, it really has huge amounts of viral load in the nose and in the mouth. And so when it comes to procedures that involve the nose or the mouth, we have to be particularly mindful about when we start doing these again.
Yeah, like rhinoplasty, septoplasty, nasal reconstruction.
Exactly. Yeah. Because there is, whenever you have viral, this is a virus that is transmitted through droplets, which means, you have to sneeze on someone or cough on someone directly or touch something directly and touch it to your mouth. But if you do manipulate inside the nose or inside the mouth, it becomes aerosolized, which means the virus releases from the droplet and it can be spread that way. And so these procedures are a particular risk to consider here.
Why else? I mean, now I'm going to talk about, kind of the healthcare providers. What else is kind of endangers them about doing surgery with coronavirus? What are the underlying issues that, let's say, I think the protective equipment issue is going to be and has been solved. Like, for instance, I know I was on a call with Cedars and they were expecting a surge of 800 patients, but they ended up getting at the maximum 120. And this is a couple of days ago. And now their census is about 80. So we know the protective equipment, I think now with the amount of supplies, are going to be eased. What else is dangerous for the healthcare providers during surgery that, we need to be aware of and patients need to be aware of for themselves?
Yeah, I think to back up a little bit, I think one of the interesting things about this virus is that it's very contagious before you get symptoms. And there was actually just an article in the New England Journal of Medicine a few days ago that talked about exactly that, where basically when you're comparing it to the flu or to SARS, which was the first iteration of this virus, you don't have high viral loads of this in your upper respiratory tract when you're initially can get the virus, but you're not sick yet. For this one, for COVID-19, before you start feeling sick, days before, you have huge viral loads in your nose and mouth. And so one of the particular concerns here is, we have to screen patients for this disease before we operate on them to make sure that they're not sick because they may not have any symptoms. So that's another component that we need to think about, because all of these protective measures are not 100%. And even if you walk in on a case where you're wearing a mask, a special mask or a gown, whatever it is, if the patient has high viral loads, it can still infect people, not just in the room, but also in the hallway and elsewhere in the facility. So, testing and is going to be a huge component of this as well. And I think one of the limitations here is going to be not only the amount of tests that are available, but how accurate they are. Because the test is only as good as its accuracy. So,
tell us a little bit about what you think you will need to kind of proceed with a patient. Let's say the city, state, all the governmental agencies say, okay, it's safe to go back. What do you think you need to feel safe about taking someone back to the operating room in a non-urgent, elective, or even a cosmetic procedure?
I think there's a number of things. I think first of all, it's really important for me to have the patient understand the risk, because there is an additional risk now. No matter what we do, it's something that they should know, and that involves probably a formal consent form that's separate from what we do normally, that says, look, by undergoing this procedure, you're going to be in a facility and there's going to be other people. And, we've done our best to contain the risk, but there is a risk. The second piece is obviously protective equipment. And I think we're still all trying to figure out what that looks like. But, if you think about, even if you're not doing a rhinoplasty or a procedure in the mouth, our patients are either intubated, which means you're sticking a tube down their throat to help them breathe because they're under deep anesthesia, or they're sedated where you're trying to continually manipulate their head and neck and their mouth and suctioning. So
these are all aerosolizing procedures.
Exactly. And so we want to make sure we have protective equipment, not just for the surgeon, but for the people in the room, anesthesiologist, scrub tech. And then also testing, and I think that's, for me, that's the big unknown now is, how much can we rely on these tests? How quick are they? If you test someone 5 days before the procedure or to get a result, and they're out in the world for 5 days, between the time they're tested and the time they get the surgery, they could get exposed. So we need tests that are quick, that are really accurate, meaning there's not very many false positives or false negatives. And then the other part of testing, which a lot of people are talking about, is antibody testing, which potentially could tell you whether people are immune, whether you're immune, whether the patient's immune, people in the room are immune. But there's not a lot of clarity now about what that means yet, for a number of reasons. I think those are the major things that I'd want to think about in terms of going back and feeling comfortable that, obviously any surgery has risks. We can stick ourselves with a needle. The patient can have a complication. That's something we talk about with all our patients. But we just want to make sure that we're minimizing the risk as best as possible and balancing it out with the benefits of what we're doing.
Yeah, and for the listeners and viewers, basically the testing, if you look at the testing, there's two types of testing. One is they're looking at actually, is the virus present? And that's done through something called a PCR, where they check for the RNA of the virus. And the sensitivity or the accuracy of it is not 100%. So you may test negative and still have it. But overall, the newer and the better systems, their accuracy rates are going higher and higher.
Yeah.
Then the antibody tests are tests that are telling you whether your body has been exposed to it. recently. That's basically our body's defense mechanism and how it's, essentially, surveying the body for anything that they've seen in the past. So we could tell if someone's actively infected or had had an infection in the past. That's also not great accuracy yet. And there are a lot of non-FDA approved and non-tested testing that are out in the market. So you just have to be very careful about what the system is and where you're getting that. Now, as kind of we end up over the next few weeks, I think, getting back into a little bit of routine, when do you foresee, we talked about surgery, but when do you foresee people being able to come into the plastic surgeon's office to get Botox, fillers, maybe lasers, skincare, all of the kind of the non-surgical procedures?
I think that depends on two things. It's one, it's the government, and that, there's when that stay-at-home requirement is lifted, when people are able to, legally go outside their homes for non-essential activities, then that's part one. Part two is the comfort of the person, the doctor doing the procedures. There's the non-surgical stuff in the short term is a lot safer than what you would be doing in the operating room. Not to say that you shouldn't be doing both, but I think that will come back more quickly to its normal levels. Partially because you're able, for most of the things we're doing, you can put a mask on the patient, you can put protective gear on yourself. You're not doing anything in the nose or mouth. You're not having to do anesthesia. And especially if you're able to do point of care testing where you can confirm the patients aren't sick, this is something that's going to ramp up pretty quickly. And I think for a number of reasons, in some ways it may be even busier than it was prior to this whole lockdown, because people are not going to want to get surgery now for the risks involved, and potentially, economically, there's been a lot of pain economically, and surgeries are costlier than non-surgical treatments.
Yeah, and that's what happened in 2008, 2009, when the financial meltdown took place, where the non-surgical procedures just really, really took off. Also, I think there are individuals who need Botox for non-cosmetic reasons. And those are individuals that are suffering from pain and tension and headaches and facial paralysis and synkinesis. And, it's really like impacting their lives. So, kind of when we talk about medically necessary procedures, in a way, those are very medically necessary for those individuals who are suffering from, prolonged, migraines, kids who have torticollis. There's, so many indications of, botulinum toxin for medically necessary procedures. So it'll be interesting, I think, as we see how, public health and governmental agencies and the cities and states start easing restrictions, how that will be impacted. What do you see as changes that will take place in plastic surgery? I'm not talking about in a month or two. I'm talking about in a year or two. How do you foresee this pandemic impacting the way plastic surgeons practice, the way plastic surgery is obtained, all of that? What changes are there on the horizon that you feel? Obviously, no one knows, but
I think the biggest change, and this is going to be across all of medicine, is things being more online. I think for a long time, people have been trying to push the telemedicine thing. Plastic surgeons have been in the forefront of that, but patients have still been uncomfortable with it for a number of reasons. It always feels better to go see a doctor in person. Overnight, doctors and patients have become much more comfortable with this methodology because they had no other choice. And I don't think that's going to go away. So what you may see is a lot of local patients doing consults from their home instead of coming to the office, which would be in the short term safer for everyone, and in the long term more efficient financially for probably both patient and physician. Physician will have less overhead in the office for patients coming in. the patient doesn't have to drive in and take time off from work, all that kind of stuff. I think that's probably the biggest change. And I think for the surgeons, I think a lot of people, I mean, you and I can both attest to it. One week we're hearing about this virus and no one really knows and everyone's going, and the next week we're shut down. And I think surgeons, doctors and businessmen and everyone that has to manage a business now is going to be thinking a lot about how much they're spending on overhead, how carefully they're running their business in order to, it's almost like that trauma from going through something where suddenly you're literally shut down and you still have all your overhead and that kind of thing.
Yeah.
So
I mean, kind of like almost a hangover, like we had from the Great Depression, where people were like, "Oh my God, I'm gonna save. I'm gonna, really reduce my life overhead and so forth." How about for the consumer or the patients? Do you think, looking forward to 3-4 years, do you think there's going to be less plastic surgery, less cosmetic surgery, or you think it's going to be more or the same? How do you foresee this impacting the consumerism of plastic surgery?
I've thought a lot about this because I do think there's a segment of the population that gets, it's hard. We both know it's hard to suss this out in our practice, but there's a segment of the population that gets plastic surgery for the wrong reasons, and they do it because they're looking for something they can't otherwise find in their life. And I think for this period of time has actually, someone said this to me the other day, it's like a values clarification. You're at home with your family, you're not working maybe, or you have a lot more downtime, you're not able to go out and distract yourself with everything going on in the world. And so suddenly you realize there are some things that are more important to you than others, and your mindset's changed about the world. And I think in some ways, actually it could go both ways. Some people may say, you know what, I'm only here once. I've always wanted my nose changed. I'm going to do it now. And other people may say, that whole thing I was worried about before is so silly in the context of what's going on. I don't need my nose changed. It's not worth it. I don't care as much. I think that's one part to consider. I think the other part is obviously that we're spending a lot more time, even before this, online on Zoom calls. We're seeing ourselves even more so than the selfies and stuff.
Yeah.
And, it's even now I'm looking at myself on the screen, judging myself as I look at the Zoom call. And I'm like,
we'll do a consult after this.
Yeah.
We'll do a Zoom inquiry after this.
Perfect. I'll turn the good lighting on so you can really see.
You do, and analyze my face. I'll analyze your face.
Perfect. So I think that'll be a piece of it. And obviously we talked about it before, but I think there's going to be an impact on our economy from this. There has to be. And whether that impacts our elective procedures, which are really sort of discretionary income based procedures, remains to be seen.
Yeah. I think there's going to be two big forces that are going to be fighting each other. One is the financial aspect, because this will impact that. But the other aspect is I wholeheartedly believe that the underlying reason people seek our services are, quality of life, feeling good about themselves. I think the majority of patients just, want to feel youthful, attractive, confident, not be self-conscious. I don't think those are going to go away. I think those are things, if someone has, a paralyzed face and it's impacting their livelihood, who they are, they don't feel great. I think they're going to want to take care of that. If someone, a teenager has a very prominent nose that's, she's self-conscious, people are teasing him or her, impacting, I think they're going to want to, do those things. And the other thing is technology is continuing, and the non-surgical services are going to there's so many new things. We don't even know what's going to be around in 5 years. So, the balance of where the financial and those things, cross will be interesting. But for sure, I think there will be some changes, as you said. And I think, maybe for the better. The immediate phase, it's going to be interesting because we're talking about how we're going to see patients in our office, how we're going to do social distancing, how we're going to, do all of the protocols, not just in the operating room, where I agree with you 100%. It's got to be like, testing, safety, and so forth, but it's got to be like that in the office too.
Yep.
We got to really, really think about all the things that's going to make the patient safe, our staff safe, ourselves safe, and also not impact public health. Because if we start kind of, transmitting viruses and, all of a sudden there's another spike, then, we've really have done wrong. So it'll be a very, very, very interesting few months and years to see how this will have a long-term impact. I want to thank you. Honestly, your wisdom and your thought process is phenomenal. I hope for all of our listeners and viewers, if you're ever considering doing anything in the next, few months, you really think about the practitioner, make sure they're doing things the right way, make sure you're not rushing into doing anything, safety, safety, safety. And also there are doctors and practitioners that unfortunately, even with this, maybe now that the surge is over, but even during the surge, they were operating and doing cosmetic surgery and things that I think that most of the plastic surgery community as a whole was not doing. And I'm proud of, I think, the community of plastic surgeons, facial plastic surgeons, oculoplastic surgeons, dermatologists. I think the core specialists really came together in a very, very positive way during this pandemic and have, we were always getting, on email and group chats and all of that. I think everyone's really doing very, very well in an ethical and positive manner for public health, which has been really fantastic. So I want to thank you guys, and thank you, Jon. And if you have any comments, please make sure you leave your comments and follow us. And we'd love to hear what topics you guys are interested in. As we get, a little bit past the pandemic, we'll get more into our beauty part of, the Smile podcast.
Taking everything
but right
over.
right now we're really focusing on the health and wellness. So I want to thank you again, and everyone have a great day.